With President Obama back in the White House, it's unlikely his healthcare reform bill will be repealed. That means individual states have 9 days to set up healthcare exchanges. SNN local news reporter Jim Spivak explains exactly what an exchange is, what it means for your health insurance, and the deadline.
Governor Rick Scott has already gone on record to say Florida will not implement their own health care exchange. If he holds true to that stance, the new health care law states the federal government must operate an exchange for any state that does not design their own, begging the question, who will govern Florida's health care exchange in the future, the state or the federal government? In a little more than a week, every state government in the country will decide if it will develop a health care exchange.
It is basically an internet supermarket that you can go and attain your health insurance.
Rich Piero is one of only 100 people in the entire country licensed and certified as an expert in Obamacare. He says an exchange, which will be set up as part of the new health care law, will be the only place that a person who makes under 400% of the poverty level can receive subsidy to help offset their premium.
We're going to have a vast majority of people that will qualify.
States that build their own exchange will be responsible for the cost of it. If a state defers, like Florida is expected to do, the federal government is left with the tab, which begs the question, how will it be funded?
Congress has to allocate these funds to help subsidize these premiums, and that's going to be a challenge all into itself.
Piero says the exchange will have different insurance companies offering 4 plans with a maximum out-of-pocket cost of $6,000 and says they're aimed at those who don't have coverage through their employer.
They're going to look identical, except your co-insurance levels will be different.
And if you do have affordable coverage through your employer but elect to leave for that of the exchange,
you could go to the exchange, but you will not be eligible for any subsidy.
Those who choose not to get coverage are subject to a penalty fee, but Piero says there's not enough incentive to get everyone into the program.
So your average worker, is he really going to spend $200–300 for health insurance now? It's actually the working poor, I call it. Those are the people that are caught in the middle.
The healthcare exchange is scheduled to go into effect in 2014, and when they do, the people that will assist you in selecting a plan and helping you find out more information, they're going to be called navigators, and these navigators do not need to be licensed or even have any background in the insurance industry.